Okay, thanks everyone for joining us today. We are going to do an overview of the new housing vouchers that are coming into the Housing Authority of the City of York. These are called emergency housing vouchers. And I have a few of us listed here on the screen, but we do also have Stephanie Beal from the Housing Authority. So I'm going to walk through the slides with you and talk a little bit about this housing program. I'm going to ask my Housing Authority partners to jump in and share information where they have it to share above and beyond what I've already talked about. So the emergency housing vouchers, I will tell you, are very new. The regulations around the housing vouchers and the announcement of the vouchers came out on May 5th. So we've only had documentation and information for about a month. There have been a lot of webinars. There's been a lot of frequently asked questions. I'm going to tell you that we don't pretend to know everything about these vouchers yet, but we are going to do our best to walk through the basics of these vouchers and how they compare to the traditional housing choice vouchers and even to the mainstream vouchers that we currently use in order to assist those that are in rapid rehousing and permanent supportive housing. The emergency housing vouchers are unique. You'll see that both the Housing Authority and the Coalition on Homelessness are listed at the bottom of this slide. And I'm obviously talking about these vouchers. These vouchers are unique because they require a partnership between the continuum of care, which is what we operate under as the York County Coalition on Homelessness, and the Housing Authority to make direct referrals. So that's kind of why we're a part of this process. We are going to work alongside the Housing Authority through the filling of these vouchers and try to do our best to prioritize for those populations that are most in need. Okay, so what are the emergency housing vouchers? The American Rescue Plan that was passed by Congress included $5 billion for, and included that money for a new incremental housing choice voucher, which is the emergency housing vouchers. You are allowed to target your populations individually by community for these vouchers in order to lease up safe, decent, and affordable housing for those that need it most. That $5 billion included some renewal costs for the emergency housing vouchers that allows them to extend fully funded at least through 2030. And then beyond that will require additional guidance from Congress. It includes administration fees for the Public Housing Authority, the PHA, to be able to provide these vouchers and to provide some additional services around these vouchers that aren't typically included with a traditional housing choice voucher. I will provide the slides after we're done today, and you'll see at the bottom there is a link to the EHV website on HUD. On that website, you will find all of the nationwide webinar materials. You'll find the frequently asked questions about these vouchers that have been updated pretty regularly. You'll find the award notices for different communities across the nation. Everything is in one place for these vouchers. Okay. So who is eligible for an emergency housing vouchers? Individuals and families who are homeless, at risk of becoming homeless, fleeing domestic violence, and those that were recently homeless are the four broad categories that the regulations around these vouchers identify. Communities may decide locally whether they're going to serve all four of these categories, whether they're going to serve a narrow focus within each of those categories. There's a lot of flexibility here for communities to decide where they're going to pivot the attention for this particular voucher. There are, of course, as with all of our federally funded housing programs, lengthy definitions around what each of these things mean. And I will provide them to you here. I'm going to talk through them at a very high level. You'll receive the slides. You'll see that there are some links included here to help you do a little bit deeper dive into what these regulations mean. So If you're serving those that are considered homeless, you are looking at the very traditional categories around a federal homeless definition. These are your folks that we call Category 1 homeless. These are people that are staying in shelters, that are living in places not meant for human habitation. Those are the traditional, literally homeless definitions, and those fall under this particular homeless definition. This definition also includes those that are at imminent risk of homelessness, which is considered Category 2 homelessness. This is a category that we in York County have not been approved by HUD on the Continuum of Care and Emergency Solutions grant funding side to serve as homeless, but it is included for emergency housing vouchers. A lot of the people that will be considered Category 2 will also show up as eligible under the at-risk definition. At risk of homelessness, those are at risk are those individuals and families whose income is less than 30% of AMI. So this one's important because this is where the 30% AMI is strictly defined by the federal regulations. And then they also have to have identified they have no support networks, family or friends that can assist them with their housing needs. And they also must have demonstrated that they are either exiting a public institution, they've moved at least 2 times in the last 60 days, or they're doubled up because of an economic hardship. Other populations that serve or that fall under at risk of homelessness do include unaccompanied youth and children who are defined as homeless under other federal definitions. This language is really common when you talk about youth populations between 18 and 24 within HUD. So these are the populations where you see this as defined as homeless under other federal regulations. There is additional detail on these in the link in the slides. And then finally, under at risk of homelessness, we have the opportunity with these vouchers to serve those families with children and youth that are defined as homeless under McKinney-Vento. So we know that McKinney-Vento homeless definitions are those that the Educating Children and Youth Experiencing Homelessness, the EHV program, uses, and they are much broader. They do include families that are doubled up. They do include families that might be living in a hotel. And we do have the opportunity under the at risk of homelessness definition to serve those populations as well. Domestic violence, this definition is pretty clear cut across many of the federal funding programs that we operate through the Coalition on Homelessness, but this is another population that is eligible for emergency housing vouchers. These are individuals or families who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or human trafficking. It's also important to note that an emergency housing voucher can be used as an emergency transfer assistance for someone who is relocating to flee those particular situations that were already identified. The PHA, the Housing Authority, has an emergency transfer plan. The Coalition on Homelessness has one as well. I'm sure they're pretty similar, but these vouchers can be used to relocate someone in that situation. And then finally, the last category are those that are considered formerly homeless. These are people who had been previously homeless, and it does have to be verified by a continuum of care or a coalition partner agency, which just looking through the panelist list, I think most of you are with, but it does have to be verified they met the definition of homelessness in the past, and that they were provided with rental assistance in some capacity that prevented their homelessness or solved or resolved their homelessness. However, that assistance, likely if it was rental assistance, will end, and they have a high risk of housing instability once that financial support ends through the rental assistance program. This does include individuals and families who are currently receiving rapid rehousing assistance and are approaching the end of that assistance and are unable to maintain their housing after that assistance ends. And it does include those who are currently residing in permanent supportive housing programs, but feel as though they would like to move on from that program. For those that might not know, rapid rehousing is typically time-limited rental assistance, where you are offered the ability to assist with your rent for a set period of time, with the intent that you will maintain that rent and that unit after assistance ends. Permanent supportive housing is different. Permanent supportive housing provides an ongoing subsidy on your rent for the length of time you spend in the program, and it provides intensive case management as well to assist you in living independently in your own unit. Permanent supportive housing is limited in York County. We don't have a lot of units for that. And because there is no end date on it, so there is no end cap on the subsidy, many people who enter those programs will typically stay, often for the duration of their lifetime. And so there's not a lot of changeover there. So this EHV voucher would allow an opportunity for those folks who feel they don't need the case management component of a permanent supportive housing program and would like to move on to a unit of their own and be independent. So this allows them an opportunity to relocate, but still have the stability of a rental assistance subsidy to make their housing affordable. Now, it's important to note under the formerly homeless definition that if you have a family or a household that you're serving that is in rapid rehousing or in permanent supportive housing, those households may also be eligible for a voucher that we currently have available called the Mainstream voucher. The Mainstream voucher operates like a housing choice voucher, or some of you may refer to them as Section 8 vouchers, but it is limited in scope to only those who are in a rapid rehousing or a permanent supportive housing program. The primary difference here is that the Mainstream voucher requires at least one adult in the household to be under the age of 62, and they must have a documented disability. It can be any type of disability. It must be documented by a medical professional of some type. The EHV voucher does not require those things. So if you have someone who is in one of those programs but does not have a documented disability or is over the age of 62, they would not be prohibited from these vouchers, where they would be from a Mainstream voucher. That being said, I am going to put a plug in here and say that we have more Mainstream vouchers than we have emergency housing vouchers. We'll talk about it later, but we have about 56 emergency housing vouchers. But we have, I might get this wrong, and I might ask the Housing Authority to step in. I think we have about 78 or 80 Mainstream vouchers.
78, Kelly.
I got it right. Thank you, Bree. So we do have more Mainstream voucher opportunities, and so we would love to be able to offer both opportunities to households to see which one is a better fit for their needs. Okay, partnerships. Partnerships are vital to this voucher. Those of you that have been through the Mainstream voucher application process with us will recognize the things that I'm going to say next, because the Mainstream vouchers also required a partnership between the continuum of care and the Housing Authority in order to make sure that referrals were being made. It is still the case. So we still are encouraging people in rapid rehousing and permanent supportive housing to seek out a Mainstream voucher for the households that they're serving, and to help them navigate the process of making sure that all of the information is provided to the Housing Authority in order for that voucher to be released to the client. But for the emergency housing vouchers, things are a little bit different. All of the referrals for emergency housing vouchers need to come through the continuum of care. The alternative to that would be that victim service providers could provide their own referrals directly to the Housing Authority if they are not operating with a coordinated entry system. So coordinated entry system is what we use within the continuum of care, or the coalition, in order to prioritize households by need rather than by first come, first serve for housing opportunities, specifically for those that are literally homeless. So what this partnership says is that the continuum of care will set up a function by which referrals for emergency housing vouchers will come to us. we will be able to prioritize them based on the community needs. And then we will refer those people to the housing authority for these vouchers. So this is different from housing choice vouchers, where typically you might help a client go on to the housing authority website and complete the housing authority application. And then they are placed on a wait list, and the housing authority moves through that wait list based on their own priorities, but also a first come, first served process. In this case, they all have to be submitted to the continuum of care, and then the continuum of care will process referrals. Part of that responsibility for the continuum of care is that we have to determine eligibility. So we have to ensure that the client and those that are working with the client have guaranteed that the client meets the definitions of those populations that we just discussed, and that that is appropriate as a referral to the housing authority for an emergency housing voucher. We do have to work with the community, and we are having some conversations within the coalition, the continuum of care, about determining targeting. As I mentioned, there are only 56 of these vouchers. We are taking a hard look at not only those categories that we reviewed on people that would be eligible, but also within those categories, who is our primary focus and what the order of priority would be for those. So we've had some feedback from the planning committee that works on the coordinated entry process that talks about some of the targeting and prioritization that we do. And we are going to be kind of putting that together as a synopsis, and we will be submitting it out to the coalition mailing list for additional feedback. But we also welcome, insight from others as well into what you're seeing in the community and what you feel the most targeted need is for these vouchers. As I mentioned, we will, as the continuum of care or the coalition, determine the eligibility. Documentation that is required is still kind of being evaluated. The housing authority and the coalition are working together to decide what needs to be submitted to the coalition, but also then what the housing authority might need to collect for their documentation as well. So more will come on that, but for now, we anticipate it will likely be a referral packet, a short referral packet that will ask for some sign-offs from case managers or from clients about eligibility. I will say that whenever a community partner can provide support documents for eligibility, it typically helps everyone. It helps the process move more quickly. So when we're talking about, for example, the 30% AMI under the at-risk of homelessness category, if you're already working with a client and you may have already been collecting documentation around eligibility of income, for example, there may be an opportunity to work with the housing authority to assist in sharing some of that information so that we can move the process along more quickly. And those of you that have worked on mainstream vouchers, I will also say we had asked folks with mainstream vouchers if they would assist their clients in working through the application process and making sure that all the documentation was submitted. I'm going to say we're probably going to have a similar ask again. We're going to ask for support where it's available. It's not going to be required by any stretch, but if you are able to help your clients and individuals you're assisting get through the application process and submit documents on time, it can be really helpful to everyone involved, and it makes sure that the clients have the opportunity to receive a voucher and to use that to move on to more stable housing. So I'm going to stop there for a minute and see if anyone of my panelists have anything to add that I maybe didn't address.
I don't have anything, Kelly.
Okay, so what makes emergency housing vouchers different? There are a few things around the housing authority process. So this is where I'm hoping Bree Coles will step in and maybe even Regina and talk a little bit about this, but I'll go through what I know. So there are some things that if you've been through a housing choice voucher process with a client, you may have encountered, and some of those things are not going to be in place or have been waived or are new based on the emergency housing vouchers. I want to be really clear that a lot of the things listed here are only for the emergency housing voucher. So these are not broad swath changes to all of the vouchers at the Housing Authority. These are specific only to these EHVs. So first of all, housing search assistance is required as part of the EHVs, which means that someone within the community, whether it's the Housing Authority, the Continuum of Care, or another partnering agency, will provide staff support to help individuals and families locate housing options for their voucher. The admission process is different, as we already talked about. Referrals will come from the Continuum of Care, who will collect them and maintain, if needed, a wait list of individuals who are interested in this process. And again, the other stipulation around that is that a victim service provider could also make their own referrals if they were, for some reason, uncomfortable with working through the Continuum of Care, or would prefer to just make direct referrals. The Housing Authority and the Continuum of Care would have to determine the best way to move those through a prioritization process if they were coming in from two channels. But we're happy to work with the victim service providers in the community on that. I mentioned already that they can be used for an emergency transfer for those that, as outlined in the VAWA Act. And also there are some changes to the denial of admission for criminal background. So there are other criminal background items that are listed on the housing choice vouchers, as well as the mainstream vouchers, but a lot of those have been waived for the EHV vouchers. So the only two categories at this time that we're aware that the Housing Authority still cannot serve are lifetime sex offenders and those that have a charge of manufacturing methamphetamine on federally assisted property. They also have an option for the look back on criminal history to be shorter. That is a waiver that the Housing Authority can elect to apply for, I believe. They are talking about, it says waiving third income and citizenship verification. I want to be really clear that it isn't really waiving it, it's postponing it. If participants don't have active access to the documents that they need when they're applying, they can request an extension on submission of those documents. But they do need to submit those documents within 90 days. So if someone doesn't have their third-party income verification, they can keep moving forward, but they do need to eventually provide that documentation. The search term for these vouchers is 120 days. I'm going to ask Bree to confirm this, but I believe under Housing Choice Vouchers, your initial time period is 30 days, and you may be eligible for up to 2 extensions of 30 days, which would get you to 120 days. However, the initial search term after you've received your voucher and while you're looking for housing under the EHVs is already 120 days up front. You will not have to request an extension to get to 120 days. And finally, the Housing Authority has the ability to set a different payment standard. They can look at the rent limits across the community, and they can make some changes to the amount of rent that they're able to pay on a unit based on these EHV vouchers. So Bree, I probably didn't get all of that right. I'm hoping you can jump in and correct what I didn't get correct.
No, it was the original Section 8 vouchers, as well as the mainstream vouchers, are issued for 60 days with 2 eligible extensions to total the 120. The EHVs will, from the issuance date, will be issued for the full 120 days. The 90-day waivers is correct. I mean, that includes Social Security cards, birth certificates, IDs. They can self-certify citizenship for up to 90 days. And the Housing Authority already has different payment standards for the county and the city. The counties are higher than what the city payment standards are.
Perfect. Thank you for that. Okay, so some of the things that are ongoing in discussion, and I'll be honest with you, like I said at the very beginning, we are all still learning the vouchers. We're still learning the best way to prioritize them. So some of the things that are ongoing in discussion, and we certainly welcome feedback from all of you, is there are 4 large categories of eligible populations, but what is the priority in York County? Who has the most need? Who should be prioritized for housing, because again, these vouchers are prioritized. This is not a traditional first come, first serve style of waitlist. So are we electing to serve a household that is homeless, for example, over a household who is formerly homeless? So those are the types of prioritizations that we have to put in place, and that we also have to share with the community so that you are all aware of who is the priority. It doesn't mean that we couldn't serve other populations or in a different order. It just means that if those populations are on our list, we would serve them first. The other thing we really need to decide is what services are needed to support some of these families. The EHV vouchers include some service dollars that will go to the housing authority in order to assist in ways that we can't normally assist. Excuse me, I had to cough. So these can include things, just as an example, these can include things as a security deposit. It could include paying to have a utility hooked up in the event that for some reason someone couldn't be assisted by the emergency rental assistance program for a back utility payment. There's an opportunity maybe to clear that payment so they can set up a new utility. There's options for moving costs. So the housing authority and the coalition have to determine eligible population priority so that we can determine what available resources we can do with those service dollars. The service dollars are finite, and I want to make that really clear. So there's no renewal on the service dollars. So once those dollars are spent on a security deposit or on a utility payment, those dollars will not be renewed with the housing authority. So we have to be responsible about how we're going to use those dollars and make sure that the way we use those dollars is most effective in getting people housed and getting more people who have a voucher into a unit. And then again, HUD is really encouraging communities to focus on how we can use the emergency housing vouchers to further the discussion of making sure that housing opportunities are distributed equitably across the community, and that everyone has the same success rate in housing outcomes. So that is something that we will certainly be looking at through kind of the equity lens for these vouchers. Anything to add there from my panelists?
No.
Okay. I mentioned the service dollars. There's a few items on this list that talk about what could be used or what could be paid for with those service dollars. Again, though, they are limited. They're capped at $3,500 per voucher, but I want to be really clear that that doesn't mean that every household who gets a voucher automatically gets $3,500 worth of services. What it means is the housing authority gets that number times the number of vouchers that you have for service dollars to use across all of these EHV vouchers. So if we're getting 56 vouchers, that's about $196,000 if my math is correct. But again, you might provide a $400 payment to this household because it's necessary for security. You might pay $50 for another household because they need help paying for the application for their unit. So it could vary wildly between the different units. But there are a bunch of eligible uses. It can be used for housing search assistance, security or utility deposits. Landlord or owner recruitment and outreach can be under this, as well as incentive payments to encourage a landlord to take a voucher where they may be nervous about doing so. You can also pay for things like moving costs, household items, renter's insurance if it's required by the lease, and even tenant readiness services. So you could even look at doing kind of good tenant classes with these individuals. So it's a large group of things you can do. The amount of money means we likely won't be able to do all of them. So once the priority populations are set, we'll have a better idea of what the most important uses for those service dollars might be based on the needs of those households. We are still encouraging households, though, to use other available resources. So those service dollars should be the last resort. For example, if you have back rent or you have back utilities, you should be going through the emergency rental assistance program the Community Progress Council is currently running in order to pay those arrears. There are already housing counseling and support agencies within our community, and so working with them to make sure that tenant readiness resources are available is a great opportunity to partnership. There are case management supports in the community through a variety of organizations. The service dollars here and these vouchers are not going to include case management. So if someone needs case management in order to have their best opportunity at stability in housing, we are going to be looking to make sure that they are tied to community case management options based on their needs. And then of course I mentioned housing location. If there are housing location opportunities elsewhere within the community, we're encouraging them to also help households they're working with locate a unit. Bree, anything there?
No.
There are a large number of frequently asked questions about these particular units, or these particular vouchers, I should say. And I did link them in the slides. We'll make sure those go out to you this afternoon. But a few of them that I pulled out that I thought would be good to discuss. The sunset date. There is a sunset date within these vouchers that means that if a voucher is vacant on 9/30/2023, so September 30th of 2023, if a housing voucher is vacant with the housing authority, no one is using it, they cannot reissue that voucher. So if someone has the voucher and is looking for housing, that remains in place. But if a unit is just, if a voucher is just sitting at the housing authority and has not been issued, it can no longer be issued after that. If someone is already in the program and already housed and still housed on September 30th of 2023, they can absolutely remain in their unit with their subsidy until they decide to leave the program, with the caveat that currently the funding for this EHV voucher runs through 2030. We don't know at this point if they will continue to fund them as a separate voucher, if they will merge them under another umbrella, but we can say that the funding is in place until 2030. Income is still a piece of this. We talked about the 30% AMI for the at-risk of homelessness category, but there are standard income guidelines that the housing authority must follow regardless of the population being served. So a family does have to be income eligible prior to receiving the EHV assistance. And this is based on the most recently published income guidelines. I did link the website there for the HUD income guidelines as well, because it does vary by household size.
And Kelly, they will, just so everybody knows, they will follow anything besides the at-risk will follow the 50% AMI.
Yes, good point, Bree. Yeah, 50% AMI for anyone other than that at-risk category. There's a lot of questions around the documentation of eligibility. I mentioned that we are working through some of this right now. However, they are requesting some third-party documentation. So I did put this in here in the event that you as a service provision organization is collecting some of this for your own documentation and files. There's a good chance that it will also be helpful as documentation of eligibility for an EHV voucher. And to just keep that in mind, we will put together and release a referral packet, and we'll have some more additional time for questions as well at the end of the month. We have another session scheduled for June 30th. But just to be aware, if you're collecting eligibility information for your programs, there's a good chance that it'll be something that they'll also need to submit for some of these vouchers. So some of the dates, just to review, I told you it was a pretty quick timeline. The 5th of May, the operations notice was released. The 10th, the allocations were announced. So that's when we found out that we were getting 56 vouchers. By the 24th, Regina Mitchell at the Housing Authority had to confirm with HUD that she was going to accept those. We did accept them and actually told HUD that if they had additional vouchers, we'd be willing to attempt those as well. Still waiting to hear on what our total allocation will be. Today is June 10th, so we're having our overview training today. The 30th is the next session, which is kind of the referral process, and also a Q&A session that'll give you time to think about the materials we went over today. It'll think, if you're someone who is watching the recording of this, it'll give people a chance to watch the recording, and then we will do our very best to answer your questions as they come in. If you want to pose questions before that, you certainly can. I will put an email address in the chat, and you're certainly welcome to send questions to that. July 1st, the Housing Authority officially gets their ability to lease up these vouchers. So we are moving relatively quickly on these. We want to make sure these opportunities get to the community as quickly as we can. So we are hoping to be making referrals in July. And then, of course, no later than the end of the month, the Housing Authority and the Continuum of Care have to finalize a memorandum of understanding, which just states that the coalition or the Continuum of Care is responsible for the referrals. It identifies the responsibilities of the Housing Authority and the Continuum of Care. It also identifies the priority list that we will have to finalize. So there is the email address. I can also put it in the Q&A if it's helpful. But that's kind of where we're at as an overview of these vouchers. I have not been checking the Q&A. I don't know if there are any questions. But if you have any, I'm going to certainly stay on here for a few minutes and let you ask them in the Q&A box, and we will certainly answer them if you have them.
Kelly, there's one question in the box in the chat.
What's really strange is I'm the host and I can't see it.
And the question is there a start date for accepting the applications and a contact person / email? This can wait if that will be covered on June 30th in the June 30th meeting. And I can answer that question. We're still working through the prioritization. So we need to get the prioritization of the waiting list before we can start accepting the application or referrals. So I would prefer that we wait until June 30th and have all of the process in place, including our community providers who will also assist with the housing search and other components of the voucher, the emergency voucher.
Absolutely, and I would agree. I think there is going to be, as I mentioned, a small referral packet, and it will likely require some sign off by client and potentially, I'm thinking, a release that your client would allow if you're a service provider, would allow us to speak with you as well to support them through this process. And so because those documents aren't released yet, we will have to hold off on applications and referrals. Otherwise, I think we would just have to come back and ask you for more information. But yes, stay tuned, I guess, is the answer on that. Okay, anyone else with questions for now? Otherwise, certainly feel free to send them in. If they're Housing Authority side, I'll certainly work with the Housing Authority team to make sure they get answered for you.
Yes, and we want to thank Kelly for actually putting this together. but it truly is a partnership between the Housing Authority and Continuum of Care, or the coalition. I forget which name they use, but that we really are eager and wanting to serve this population that we don't normally serve. And it gives us a good opportunity to assist people and families that actually kind of fall through the homeless gap, that have a potential of being homeless or are homeless. And because they don't meet the criteria of homelessness, the other definitions, they don't often get served. For this is actually this opportunity to help a broader segment of the population and community that needs assistance, and to get them in stable housing environment. We often believe here at the Housing Authority that if you get somebody into stable housing, you stabilize their lives. And that's what we are here to do. And we really are anxious to get this started. And as soon as we get more information, either the coalition or the Housing Authority, it will be coming out. But stay tuned for June 30th, because we definitely will have some more information and how we're going to proceed with this process. And so that we can get families housed and situated, and perhaps get them housed before school starts, which would be an awesome accomplishment. So stay tuned.
I will say, and I think it's important to address what might be a little bit of the elephant in the room, is we're all aware of how tight the housing market is right now, and how hard it is if you're working with a client who has a mainstream or a housing choice voucher, how hard it is to find a unit either that meets inspection or has an owner or a landlord that's willing to take a voucher. We are keenly aware of those challenges, and we know that we will have those challenges with the emergency housing vouchers. We're hopeful that those service dollars allow us to be able to offer a little bit more incentive for a landlord to be willing to work with a family. So we're hopeful that that flexible option on these vouchers can give us a better success rate, I guess you will. We also recognize that if the eviction moratorium ends at the end of June, which it is currently scheduled to do, that there will be a lot of shifts in housing, and it will be probably for quite some time. So we are anxious to see if we can house up as many people as we can in the short term, but recognizing that we see and hear those unit challenges, and we are aware of them. We're just hopeful that we can still push through and get some people housed. Okay, I see no other questions, so I am going to let everyone go. I'll give you 15 minutes back. This was recorded. We will make sure that a link to the recording goes out to all of the participants and everyone who registered, and I will also make sure that the slides go out as well. Otherwise, I guess we will see you on June 30th, and we will talk a little bit more about the referral process and next steps. Thanks for joining, everyone. Bye-bye.
Thanks, everyone.